And recording is underway. So Dr. Garcia, if you want to, it's 11 o'clock. If you want to start us off with an opening statement, that'd be great.
Absolutely. Anthony, am I centered? Is this where I need to be?
I think it looks good.
Okay. Yeah. Okay. Thank you so much, everybody, for joining us again today. Thank you for making this process easier on us in terms of being able to respond to your queries. It really helps a ton to be able to bunch them together. My name is Francisco-Garcia. I'm the Deputy County Administrator for Community Health Services, as well as the Chief Health Officer, Medical Officer for Pima County. So I'm just going to start off with some quick remarks and quick things to show you, and then we will go from there to your questions. So what one of the big things that I wanted to sort of make sure that was on your radar screen is that indeed this is Pima County, this is from the state website, this is the number of cases per week. Indeed, we appear to be plateauing or perhaps starting to go down. And although we are not yet ready to have a party, I think that this is in general a good sign. This continues to be something that we watch very carefully. One of the things that we know is that we are having certainly more cases than we were back in June and July. So still a lot of cases. But again, I believe that we are starting to see a trend toward either a plateauing or perhaps even a decrease. And that is true, when you look at sort of different demographic groups. The other piece that I will share with you that is related to that is importantly that in terms of our vaccination coverage overall, we continue to trend upward. At this point, 75.6% of all individuals who are 18 years of age or older have received at least a single dose, and fully 66.5, and today it will likely hit 67%, have actually been completely vaccinated. Again, that is a tremendous achievement and something that we continue to work on really hard. Again, we continue to have a better vaccination coverage than the rest of the country and the rest of the nation. The distribution of that vaccination coverage in this county is really interesting. And this is from our vaccine dashboard, which is updated as of earlier this week. And just to make a couple of points that are really important. Number one, we now have 3 incorporated jurisdictions that have hit this critical threshold. That is Sahuarita, Oro Valley, and Marana all are at that 75% or almost 75% on the part of Marana. This is really, really critical. I also want to sort of make the point here, and unincorporated Pima County, 63%, Tucson, 62%, and South Tucson, 50%. I also want to make the point here, though, that when we talk about these very considerable successes, we also need to be very realistic about the fact that those unvaccinated individuals in these communities continue to be a source of cases. And what we're seeing across this community and across this county is that the cases that are being generated, especially the cases that are resulting in hospitalizations and deaths, continue to be among that unvaccinated crew of individuals. So yes, Sahuarita having 79%, really awesome, really something to celebrate. But the fact that there is this residual 30% unvaccinated population continues to be of concern. We'll never get to 100%. It probably is not realistic. However, every time that we vaccinate an additional individual, it means that our communities are safer. For those individuals who can't become vaccinated for a medical indication, for those folks who are older and who are more likely to become critically ill, and for the very young individuals who are less than 12 years of age who can't possibly be vaccinated. I think that that's a really important point to make. I'm going to just share with you one more thing, and then I will shut up and let you ask questions. The piece that I want to share with you is the where we are in terms of our schools, because again, most of the questions that we continue to be, most of the questions that I'm getting continue to be in this area of school-related vaccination. And here is the stuff that I will share with you. And I'm trying to project it differently so that hopefully you can have a clear view of the slides. So we're up to 1,705 school-related, school-reported cases. That is a lot by any measure, but again, as large as that number is, I think one of the bright spots here is that we're actually not talking about 1,705 outbreaks. The schools have done a very, very good job of mitigating the risk to their students, and so that the number of actual outbreaks in our schools and in our classrooms is relatively limited. So these are 1,705 cases that have occurred, some of which certainly are school-related, school activity-related. Some of them are clearly community acquired, family acquired. So a lot here to celebrate and a lot here to recognize. I think you'll also see that it appears to be tapering some to a certain extent. The distribution in terms of faculty versus student is still about the same. And I think that this is important, which is the whole issue of where are schools, where are these occurring? Again, the largest school districts sort of suffering disproportionately. But again, my point being that charters and privates, especially taken together, end up being a very, very significant portion of that group. I'm going to stop there with the prepared remarks and open it up to your questions, and because I have a little bit less time today. So Tony, I will turn it over to you.
We can get started. Craig from Gun is first, and Angelique from KVOA is after that.
Hi, Doctor. Thanks for taking some time for us. With the federal vaccine mandate that came out last night, are you concerned at all about the ability of pharmacies, doctors' offices, and so on to meet a jump in demand? And if so, is the county considering reopening mass vaccination? If you do that, are you concerned about an unimpeded supply of vaccine from the state, seeing as the governor is in favor of vaccinations but not mandatory ones?
I really don't believe that we'll need mass vaccination sites. The truth is that there is now sufficient capacity across the system, whether it is in retail pharmacies, from Costco to CVS to Walgreens to Alberts and Safeway. Every single one of them has vaccine availability, has vaccine stock, and has the ability to deliver that stock in those community settings. On top of that, you have our partners, the federally qualified community health centers, that also have abundant vaccine stock in hand, that also have abundant capacity to deliver it to patients and individuals. On top of that, we have created the safety net for folks who may not be able to do that through our mobile vaccine efforts. All those things continue to move forward. All those things are important. I believe that we have both sufficient vaccine, sufficient personnel capacity, as well as kind of sufficient communication with regards how to do that. I do not believe that I do not believe that or I do not expect to hear any direction from the state that would impede us from doing what we know we have to do. Next question, please.
It'll be from Angelique from KVOA, and then Bud from KOLD.
Yes, good morning, Dr. Garcia. In terms of mitigation regarding the flu vaccine, I know apparently it was a little bit more better news last year that there was reduction in the flu just due to wearing masks. What is the outlook moving forward into fall and winter, especially when it comes to specific demographics, including the elderly, and especially for children right now, as they are already in school, they're already worried about, you know, about COVID-19, parents are concerned. What is the outlook with the flu, and just
One of the,
you know, just some information regarding all of that, please.
Sure. One of the things that we came to understand with the last year's flu season is that, geez, wearing masks really does help decrease the risk of respiratory infection. And you know, historically, even the sort of public health infrastructure has kind of poo-pooed public mask wearing historically, you know, looked at places like Asia, where it is much more customary as being a little bit odd. Now it is super clear that mask wearing is a good intervention. Remember that we, as the county and certainly our health department, continue to say that because of the current level of transmission, which continues to be high, if you look at the COVID data tracker map, the entire country, pretty much, except with an exception of a few counties, continues to be bright red. That is, be continuing to experience very high levels of COVID transmission. In that setting, the use of masks is really critically important, and the use of and the other sort of practices in terms of staying home when you're sick and trying to create some physical distance between you and others, especially indoors, becomes really critical. How this is going to play out this particular flu season, I think, is still yet to be determined. You are absolutely right. The most vulnerable people every year, before COVID certainly, that are impacted by flu in a bad way, that is, that have bad outcomes, hospitalizations, deaths, are the elders, as well as our very young folks. So, you know, that's going to be a critical piece as we continue to move forward. I know I'm certainly planning on getting my flu shot and taking my boys for the same thing. Next question, please.
And that'll be from Bud Foster, and then Andrew Oxford from Arizona Public Media after that.
Dr. Garcia, thank you very much for doing this. We really do appreciate it. Now that we have a federal mandate on the table coming out of the White House, how might that work on the local level? Because it's a mandate, which means there'll be some kind of an enforcement action here. There needs to be. Will you work with the feds to do this? Will the feds ask you? How would this relationship between the federal mandate and the local health department work?
Bud, you're asking a really super important question, which is, you know, how is this proposed federal strategy going to be implemented? I don't know if you listened in on the White House coronavirus briefing this morning, but that was actually part of the conversation there. The truth is that at this point, the federal government, in terms of its mandate for employers of 100 or more employees, they're still making these rules up. And in fact, the Secretary of Labor has been directed to you know, oversee this rapid regulation setting process. This rulemaking stuff, though, is going to take a little bit of time to actually get done. So the truth is, we don't know. I believe that the federal government is doing the right thing by saying, geez, large employers, you have an affirmative responsibility to get your people vaccinated, protected for their own sake, for the sake of the public. But in terms of how the penalties will come, to me, it appears to be through OSHA. Employers are sanctioned by OSHA when they don't do X, Y, and Z. That's my read of the federal of how the federal mandate is going to be rolled out. But we remain very interested and very engaged and very aware of the fact that this is going to be a complicated rollout, and hopefully, I believe, will be a good thing. Next question, please.
Andrew, you're up, and then Ariana from Azteca Tucson.
Hi, good morning, Doctor. Expanding on that, given the contours of the president's proposal, given the workforce in Pima County, the vaccine uptake here, what effect do you anticipate this proposal would have at the local level in terms of raising the vaccination rate?
Yeah, I think if what you're getting at is how much are we going to, how many percent, how much are we going to be able to increase? The truth is, I don't know. We know that we have a recalcitrant kind of group of individuals that we have a very big challenge trying to get vaccinated. I think at this point, though, especially for a county like this, like Pima County, where our vaccination coverage is actually fairly good, it will continue to add icing to the existing cake. I really think that we are in a very good position with regards to our vaccine coverage. And I think that this only enhances that. How many employers over 100 is part of the question that you're asking. So understand that in Southern Arizona and in Pima County, we have a lot of employers who have less than that workforce. So a lot of what the county health department has been doing and a lot of what we've been engaged in is in strategies to assist those employers who are smaller, who perhaps have a smaller workforce, but that are certainly very common in this community with getting them vaccinated. So I think that, again, the federal mandate is a good thing. I believe that the federal mandate will make a difference. I think we need to go think beyond the mandate to where are the other places in our community that need assistance in terms of getting vaccinated. And as far as I'm concerned, one of those groups happens to be small businesses, and we need to figure out how to make sure that we're putting resources in their hands to get their employees and their customers protected. Next question, please.
It'll be from Ariana and then Valerie from KWLD.
Buenos días, doctor.
Buenos días.
Mi pregunta, habló sobre esto temprano en inglés, pero le quería preguntar en español sobre la vacuna de la influenza y qué tan importante es vacunarse ahorita contra esto, especialmente durante la pandemia y también para niños.
Mira, Ariana, es súper importante ahorita. Típicamente estamos empezando la temporada de la influenza, ¿verdad? O gripe, como también se llama comúnmente. Esto es un reto que sobreponemos cada año, en cada temporada tenemos esto. Pero en este caso también tenemos la coronavirus, la pandemia por el coronavirus, como uno de los factores que tenemos que tener en mente. Uno de los mensajes más importantes que estamos tratando de transmitir es que para aquellas personas que ya han sido vacunadas contra el coronavirus, no olviden que también necesitan vacunarse contra la influenza. Y dense cuenta que específicamente la influenza es muy severa. Los casos de influenza pueden ser muy severos y aún hasta mortales en personas de edad avanzada y también en los niños. Así es que es muy importante enfatizar que tenemos que recordarle a nuestra comunidad que también necesitan esa vacuna. Siguiente pregunta. Next question, Anthony.
That'll be from Valerie and then followed by Benito from the Tucson Sentinel.
Oh, yeah. Hello, Dr. Garcia. Good talking to you again. With the companies and government mandating vaccinations, certain companies, what are you seeing in terms of people attempting to get fake vaccination cards? In one case, offering a bribe to an EMT at a vaccination site. Now, I know that sites must report these incidents to your department. Are you seeing an uptick?
Valerie, the reporting of those kinds of actions is actually through kind of these federal channels, and is certainly being encouraged. We are not aware of widespread fraud. There will always be entrepreneurial people and motivated individuals who will try to get around requirements or recommendations from certainly from government, certainly from public health authority. We know that happens. The important part isn't the darn card. The important part is the protection that the vaccine affords folks who are protected. The ways that employers go about getting this information about whether folks are vaccinated or not is going to vary also. Some folks, some entities perhaps who are self-insured will have ways of being able to verify that. So I think this is still to be determined. Yes, people are incredibly creative and entrepreneurial, but I'm not seeing widespread fraud with regards to that. Next question, please.
Okay, we have about 9 or 10 minutes left. Right now we have Benito, and then Craig Smith is up for his second question.
Hi, Dr. Garcia. Thank you for taking our questions again. I was hoping you could talk a little bit more about hospitals. We heard reports that someone had been transferred to Phoenix. Could you let us know what kind of relief might there be for hospitals and what they're kind of dealing with right now?
So, I'm not sure the report that you're referring to. I'm not. I know that the surge line, which the state set up, moves patients around as the need arises. I don't know who was or was not transported up to Phoenix. It's not uncommon for transports to occur to Phoenix, by the way, depending on the needs and depending on a lot of things. So I don't have any specific on that. So what I can tell you is that as of yesterday, 22% of ICU beds were being used by COVID-19 patients. Now, the part that is really important for you guys, that's more than 1 out of 5 beds, right? The part that's really important for you guys to remember is that COVID cases that are intubated end up being really long. Most stays in the hospital, as you well know, are very short. COVID stays in the hospital are very long, as in days, weeks, and sometimes even longer. And so once you tie up a bed, tie up a ventilator, tie up staffing, serving a COVID positive patient, it's a long-term commitment, and you're not going to turn over that room. For instance, if I had open heart surgery, I'd be expected to be in the ICU, maybe overnight. The next night, I'd be in a regular, hospital ward bed, and then the next day, I'd probably be at home. That kind of quick turnaround does not happen with COVID patients because they are extremely ill, because they require lots of respiratory support. So that's the reason that we're seeing so much compromise and so much tie up in the and sort of hospital resources. What you heard from the feds yesterday was that they were going to open additional resources from the Department of Defense and make those available to hospitals that are having staffing shortages. And honestly, that's what the main challenge has been. And you can talk to the people at TMC and at Banner, St. Joe, St. Mary's, and Northwest, and they will all tell you that their greatest challenge right now is keeping their beds staffed. I think that federal relief will be helpful. I know that we've assisted hospitals in the process of requesting some of that federal relief, and we're still waiting to hear on the adjudication of those requests. I'll take the next question.
Okay, we have 3 things queued up right now. We have Craig and then Bud and then Andrew again. So we'll see if we can get through those 3 before you have to leave, Dr. Garcia. So Craig, go ahead.
Doctor, perhaps you're already doing some of this. Do you expect to be doing on-site shot clinics for either the 100+ companies, the smaller companies you were talking about, or both?
You know, a lot of those larger, we have made mobile vaccination available to many employers across this county. We have, and we will continue to. And when we are invited to go do a vaccine clinic at Corporation X or Business Y, Restaurant Z, we will do it. In fact, we are even developing strategies that allow us to bring out vaccines even to smaller groups, to groups of say 10 or so folks. So yes, we will continue to do that. We're doing that now, and we will redouble our efforts. My goal is to make sure that there is not a single person in Pima County who wants to get vaccinated who can't access that service. So if we can sort of focus on that, I think we will be in good shape. I forgot what the second part of the question was, Craig. Or maybe there wasn't.
Not sure. I think that it kind of answered it.
Excellent. I'll take the next one.
Yeah, hearing nothing from Craig, let's go to Bud.
Dr. Garcia, how would you describe the school year so far in the number of cases, what you planned for, what you expected, maybe what was unexpected, and also what concerns you when you see the numbers where they are now?
So, but gosh, more than now 6-7 months ago, you asked me a similar question. What keeps me up at night, and what could we expect for the school year? I was really sort of hoping to have a normal school year, and normal school year with mitigation, by the way, with mask use, with physical distancing, with temperature checks, with parents being really sort of on the mark in terms of keeping kids safe, and then the Delta variant hit. And what I did not anticipate was that the transmissibility of that Delta variant and how particularly vulnerable that left our unvaccinated population, and in particular children between the ages of about 4 to about 11 who are not vaccinatable, how much it left them like sitting ducks in those environments, whether it's school, whether it's daycare, whether it's a play group, whatever it is. The transmissibility of this particular variant is very concerning, and is the reason why it has gotten why it has penetrated our community so quickly. As I think about where we need to continue to put resources in, I think we need to continue to support our school districts as they mitigate and as they try to do the right thing. That is to require masking in all their indoor spaces, to do the best that they can to make sure that all their employees and vaccine eligible age children are vaccinated. I think that that's the way we get back to normal. I think we're starting to see with our vaccine penetration, I believe that if we continue in the same route, we do get to a much better place, but we're not there yet. Next question.
Next question, last question from Andrew Oxford.
Hi again, Doctor. If I understood correctly, you seem to have some concern about the numbers in charter and private schools. Am I understanding that right? And what in those numbers concerns you?
No, it wasn't so much that I'm picking on charters and privates. That's not it. But one of the recurrent questions that certainly the board has received as part of it have been statements around the fact that aren't charters and privates doing so well, and they don't have any problems, and they're not doing X, Y, and Z. I want to make sure that it is very crystal clear that the impact of the Delta variant is being felt in every single school across this county. Every single school, whether it's a public school or whether it's a private or charter school. I'm sorry, whether it's a charter school or whether it's a private school. And this is something that is impacting us all. And that the strategies that schools use in order to protect themselves, regardless of whether you are a private, a charter, or a public school district, are going to be the same. Are going to be about requiring mask use, are going to be around the issue of vaccination, around the issue of keeping children as far apart as possible, and keeping sick people at home. So if it came off that I was picking on them, I'm not. I just want to point out the fact sometimes the charter and private numbers, because they're relatively smaller, because school X, basis Lehman, whatever, is a smaller, it looks smaller, but when you aggregate that whole group of schools, like you would in a school district, you start seeing that there are significant numbers of cases even in those settings. Thank you all for your questions today, and I appreciate you guys being flexible with us, and we will continue to do this if it's helpful to you. And thanks again for all you do. Appreciate it. Bye.
Thank you.
Thank you.
Thanks. If any media hasn't already, please leave your email in the chat and we'll get a recording out to you.